Do14 is on the posterior midline, below the spinous process of C7 in a depression.
Gallbladder 21 is located midway between Do14 at the base of C7 and the lateral extremity of the acromion process, but at the crest of the trapezius muscle. To find the crest of the muscle, it may be necessary to dip down slightly to make sure you get the highest part. This point forms a line with Sanjiao 15 and small intestine 13. Gallbladder 21.
Bladder 11 is 1.5 cm lateral to the posterior midline, below the spinous process of T1. Going to find the inferior border of T1 and come directly lateral to it on the height of the paraspinal muscle. Do12 is on the posterior midline, below the spinous process of T3. Do4 is on the posterior midline, below the spinous process of L2.
Gallbladder 33 is located on the lateral aspect of the knee, in between the tendon of biceps femoris and the lateral epicondyle of the femur. To bring the tendon of biceps femoris into relief, have the person pull their heel back against the bed. You should be able to feel this tendon quite clearly now. When the person relaxes their leg, you should find this depression more or less on the same height as the superior border of the patella.
Bladder 54 is on the buttock, 3 cm lateral to the sacral hiatus. Typically, if you put your hands on the sides of the buttock, it is midway between the sides and the gluteal fold at the midline. Gallbladder 30 is in the posterior lateral aspect of the hip. It's at a junction from the anterior 1/3 and posterior 2/3 of a line taken from the prominence of the greater trochanter and the sacral hiatus.
Small intestine 5 is on the ulnar aspect of the wrist in depression between the triquetral bone and the head of the ulna. The small intestine channel is starting to travel more dorsally, so you can find this point between two tendons that are running across the wrist joint. Sanjiao points on the forearm are best located with the arm laying flat on the bed and the elbow turned outwards. To find Sanjiao 5, come 2 cm proximal to Sanjiao 4, in between the radius and the ulna. You should be on the radial side of the tendon of extensor digitorum communis. If the person wiggles their fingers, this tendon will come into relief. Large intestine 11 is located at the midpoint between lung 5 and the prominence of the lateral epicondyle of the humerus. Typically, this is at the end of the transverse cubital crease when the arm is fully flexed.
Heart 5 is on the flexor aspect of the forearm. It's 1 sun proximal to heart 7, on the radial side of this flexor carpal ulnaris. Heart 7, which is at the flexor aspect of the wrist joint, at the proximal border of the pisiform bone, the radial to this flexor carpal ulnaris tendon. In order to bring this tendon into relief, if you get the patient to put their thumb and their little finger together, that will bring that tendon up. And just relax. Articulate the wrist and pop your point in. Pericardium 6 is on the flexor aspect of the forearm. It's 2 sun proximal from pericardium 7, and it's in between the 2 tendons palmaris longus and flexor carpal radialis.
Bladder 60 is located directly posterior to the prominence of the lateral malleolus. It lies in the deepest dip between the posterior border of the malleolus and the anterior border of the tendocalcaneus. Stomach 36 is located approximately 13 sun superior to the prominence of the lateral malleolus on the anterior border of tibialis anterior. The easiest way to find it is to palpate down the tibial tuberosity. Find the base of the tibial tuberosity and move slightly laterally until you fall into a nice dip on the anterior border of tibialis anterior. This point is also 3 sun inferior to the inferior border of the patella. The easiest way to find spleen 9 is to palpate gently up the medial crest of the tibia until you fall into a nice depression formed by the medial crest of the tibia and the inferior border of the tibial condyle. This point's in a depression. It's not on bone, it's not on muscle. It's in a tender depression. Spleen 10 is located 2 sun superior to the superior border of the patella in a tender depression on the height of the muscle vastus medialis. We know the patella is 2 sun long, so we can use this to calculate how high up the leg this point should be. A common mistake is to mark this point too far anterior or medial. A good location tip is to have the person press their leg down into the bed, which will bring vastus medialis into relief, and you should be able to palpate the depression in the height of it that forms spleen 10. Gallbladder 31 is located directly inferior to the prominence of the greater trochanter, 7 sun superior to the inferior border of the patella. To find the prominence of the greater trochanter, press the hips on either side to feel for a bony protuberance. To double check that you've found the greater trochanter, rock the leg from side to side and feel the bony protuberance moving underneath your hand. distance between the greater trochanter and the inferior border of the patella is 19 sun. If you divide this distance into 3 equal units, each one of these units will be 1/6 and 1/3 of a sun. As the point we're after is 7 sun superior to the inferior border of the patella, it lays just a little above the superior border of the lower third. Large intestine 18 is located on the side of the neck on a contour with a laryngeal prominence. It's in between the 2 bellies of the sternocleidomastoid. To bring the 2 bellies into relief, have the person turn their head against resistance. It becomes quite easy to see the sternal and the clavicular bellies of this muscle. Locate your point in between the 2 bellies and then have them relax their neck again. Kidney 7 is located 2 sun directly superior to kidney 3. Locate your kidney 3, move up by 2 sun and mark this point directly on the anterior border of the tendocalcaneus. Spleen 6 is located 3 sun superior to the medial malleolus, half a finger breadth posterior to the medial crest of the tibia. Be sure not to place this point actually on the bone. The easiest way to locate liver 8 is to fully flex the leg, place your finger on the medial end of the popliteal crease, open the leg up to 90 degrees and then travel slightly superiorly, that's up towards the head, a very small distance until you fall into a nice dip that is anterior to the tendons of semitendinosus and semimembranosus. It's about 1 sun anterior to kidney 10. Liver 11 is located 2 sun directly inferior to stomach 30 on the medial border of the muscle adductor longus.